Have you ever woken up with a strange, unsettling feeling like your head isn't quite yours? A numbness, a fog, a sensation that something is wrong, but you can't pinpoint what. You touch your scalp, you shake your head, you Google your symptoms at 3 a.m., and suddenly the worst case scenarios start flooding your mind. Is this a tumor? A stroke? Am I losing my mind? If this sounds familiar, take a deep breath. You are not alone. And more importantly, in the vast majority of cases, this is not a neurological emergency. Today, I'm going to walk you through exactly why your head might feel numb, the 3 real reasons behind this symptom, and what you can do starting today to feel like yourself again. In my clinic, I see 3 distinct types of patients who walk in with this exact complaint. Understanding which one you might be is the first step to peace of mind. First, the worried well. These are intelligent, health-conscious individuals. Their numbness triggers a cascade of fear. Could this be a brain tumor, a blocked artery, an aneurysm? Their anxiety is real. Their symptom is real. But here's the critical truth. If your numbness comes and goes, shifts locations, or is paired with stress, you are statistically far more likely to be dealing with a functional issue, not a structural brain disease. Second, the headache sufferer. This patient experiences numbness alongside tension headaches or migraines. The scalp feels tight. The forehead feels heavy. The connection? Muscle tension. When your neck and shoulder muscles are chronically tight from stress, poor posture, or screen time, they can compress nerves that refer sensation to your scalp. Reassuring. The numbness isn't in your brain. It's in the wiring leading to your brain. Third, the anxious mind. This is the most common profile I see. These patients describe a floating numbness, often on one side of the head, paired with restlessness, heart palpitations, or that classic impending doom feeling. Here's the neuroscience. Anxiety activates your sympathetic nervous system, your fight or flight response. This can cause hyperventilation, changes in blood flow, and heightened nerve sensitivity. Your brain isn't damaged, it's over alert, and that over alertness can literally feel like numbness. Now, let me be crystal clear. I'm a neurologist. I take neurological symptoms seriously. So, when should you seek immediate evaluation? Go to the ER immediately if you have sudden, severe numbness that doesn't fade, or numbness with facial drooping, slurred speech, or arm weakness, or loss of vision, confusion, or loss of consciousness, or numbness after a head injury. Most common causes are usually not emergencies. These include stress and anxiety disorders, cervical spine tension or poor posture, vitamin B12 or D deficiency, sleep deprivation or chronic fatigue, and medication side effects. Here's my clinical framework. If your numbness is intermittent, migrates, or correlates with stress, it's highly unlikely to be a structural brain problem. But if it's persistent, progressive, or paired with other neurological deficits, we investigate further. That might include checking your neck mobility, blood pressure, blood work for deficiencies, or in select cases, an MRI. But we don't scan first, we listen first. So what can you do starting today to reduce that numb, foggy, disconnected feeling? Here's my 5-step protocol. First, breathe to reset your nervous system. When anxiety triggers numbness, your breathing becomes shallow. Practice this now. Inhale for 4 seconds, hold for 4, exhale slowly for 6. Repeat 5 times. This activates your rest and digest mode and can reduce numbness within minutes. Second, move your body, free your nerves. Tension in your neck and shoulders refers sensation to your head. Every hour, gently roll your shoulders back 10 times. Tilt your ear toward your shoulder, hold 15 seconds each side. This isn't just stretching, it's nerve decompression. Third, hydrate and supplement smartly. Dehydration thickens your blood and reduces oxygen to nerves. Aim for 2 to 3 liters of water daily. Also, ask your doctor about checking vitamin B12 and D levels. Deficiencies in either can cause neurological symptoms like numbness. Fourth, protect your sleep like your brain depends on it, because it does. Poor sleep lowers your pain threshold and amplifies sensory abnormalities. Create a sleep sanctuary. No screens 1 hour before bed, cool room, consistent bedtime. Even 1 week of better sleep can dramatically reduce neurological symptoms. Fifth, reframe the thought loop. When numbness strikes, your brain may spiral. This is dangerous. Interrupt that. Say aloud, this is uncomfortable, but not dangerous. My nervous system is overreacting. This will pass. Cognitive reframing isn't positive thinking, it's neural retraining. Your head feeling numb is your body's signal, not necessarily of disease, but of imbalance. Stress, tension, fatigue, anxiety, these are treatable, reversible, manageable. You don't need to live in fear of your own sensations. You need clarity, you need a plan, and you need to know in the overwhelming majority of cases, this symptom is your mind and body asking for care, not a warning of catastrophe. If this resonated with you, share it with someone who needs to hear it. And if your symptoms persist despite these steps, please see a neurologist for personalized evaluation. Your peace of mind is worth it. I'm Dr. William. Take care of your brain. It's the only one you've got.